everyone. I would like to call this meeting to order of the Ad Hoc Committee on the Fine Arts beginning at noon. It is 12:01. Thank you everyone for being here and joining us, and to our guests on Zoom as well and our community partners. We really appreciate it. Can we please have a roll call, Angela?
Desart, Garcia,
Here.
Hart, LaPlante,
Here.
Rutledge,
Here.
Selman. I got you.
Okay, wonderful, thank you. I will entertain a motion to approve the minutes from the Ad Hoc Fine Arts Committee. It was our regular meeting on Tuesday, August 17th, 2021.
So moved. Second.
Great. Do we need a roll call for that too, Angela? No, wonderful. Voice vote, please. All in favor? Aye. Any against? That motion passes. Terrific. Do we have any public comments today, Angela? We do not. Great. Moving on to Chairwoman's remarks. I'm really grateful that you all took the time to be here today. I called this meeting because last week at our county board, full county board meeting, we heard some sobering news from the executive director of our DuPage County Health Department. And more importantly, we've received some alarming statistics about the increasing transmission of COVID-19 in our community, particularly among young people and children. As you know, the DuPage County Fine Arts Festival is scheduled to take place in just under a month. As chair of this committee, I have repeatedly stated that we are keeping an eye on the COVID numbers and are working hand in hand with our health department. For that reason, I have invited Executive Director Karen Ayala here to provide us the very latest statistics and to discuss the state of the COVID crisis as we sit here today. I know we were also joined by Chris Hoff from the health department as well, and I am grateful to both of them for their leadership and their guidance through these very, very difficult times. So with that, I will ask Karen to provide an update on the numbers and transmission rate that we are seeing currently here in DuPage County. Thank you, Karen.
Thank you, Chairwoman LaPlante, and thank you for this opportunity. For those of you I haven't met, my name is Karen Ayala, and I serve as the Executive Director of the DuPage County Health Department. One of the best parts of my job is I get to work with Chris Hoff, who will be joining me. Chris has been an amazing leader and a public health advocate during this entire COVID response. So with that, we'll start off with a look at the dashboard that we have used to ground many of our updates. You will see that unfortunately it appears this week that in the top left corner that we will actually surpass 100,000 COVID cases in this pandemic. We are, and probably the money shot, if you will, for this dashboard is the community transmission level. And those are levels that CDC identifies in communities and has to do with the rate of cases, not so much the number of cases, but the rate of cases that are occurring in a community. We'll come back to the, let's go ahead and click on that, Chris. If you're on our website and click on it, it takes you, we get this information, as I indicated, from CDC. It takes you to a county view, you can get to the county view of their data tracker. This is though, for those of you who might not have seen it, this is a snapshot of where the country is right now, red being the absolute highest rate of transmission, and blue being the lowest. Actually, I'm kind of surprised that we have so much blue. We have not had this much blue, and hopefully that's a very positive sign for some of the communities that have been in red. Then you can look at and filter down to DuPage County. And see that as the national graph indicates, we as a state are also all in high with the exception of one county. High transmission level indicates a 7-day rate of over 100 per 100,000 individuals. As of yesterday, I believe we were at like 149. So we are moving up on the barometer or the thermometer of case transmission, community transmission. Still, we are seeing over 100 cases routinely, 150, 200, 300 cases a day again. And as those of you who have followed us for a while, we were back the end of June, first part of July, we were in 10 cases a day or lower for a significant period of time. So again, this represents a significant activity in our community, high rates. You'll also see new hospital admissions. And I'll talk more about that when we get back to that, back to the dashboard. Chris, anything I'm missing on this slide?
Just to say, you can see the raw numbers here. There's also a percent change over the past 7 days. So if you're interested in understanding the change across that week-to-week period, as Karen said, cases are up almost 12% in the past 7 days. Deaths have increased and new hospital admissions, and we'll share a little bit more about that, but just know that that's also available to you to provide some context. Thanks.
Yes. So we do not believe that we are at the peak of this current surge yet, because of that double-digit growth. Back to our dashboard. So where are the cases occurring? We can take a look at the different age groups. And again, this is since the start of the pandemic. You can slide the top and come up with a better reflection of where we're at currently. You will see that although the 80 plus age group has had some ups and downs, they are the age group that has the lowest case rates. And you will see that the next lowest is a 60 to 79. But again, as we compare and contrast where we're at now to where we were even back in May, we're at a higher rate. And you see the decline the last couple of days. I would caution against that because we have had issues with interpreting that too broadly because we've had issues with the reporting system in the state of Illinois. So, so there's a view of that. And then finally, if we could go to, because we have, 100,000 cases, it seems to be a kind of a stunning and stunning number. So where are we at with hospitalizations? Because really it's the acute cases that we're most concerned about. And so when we look at the hospital capacity, and we've certainly been hearing about stories not only nationally, but now in the state of Illinois about hospital capacity. We also see that hospital capacity, the number of individuals in our community requiring hospitalization has increased significantly since the end of July, as has concerningly the number of individuals, the sickest individuals in the ICU. So we saw our highest count for hospitalizations actually yesterday. If we look at a longer view, you'll see that certainly hospitalizations hit an extraordinary level back in winter, November, December of 2020. However, our current rates are equaling where we saw our surge, probably our third wave of COVID activity in the community back in April of this past year. Now, we in DuPage do have a robust hospital capacity, right? Because some parts of the state where you have one hospital for 5 counties doesn't have the kind of resources. But even with that, we see that our capacity is getting very close to the 20%. And you're going to pull up that last, the kind of 20% baseline, which is where if you go under 20%, that's another warning sign for your community. We're at 22%. Now, this isn't for DuPage alone. This is, we receive this information from IDPH based on regional. And so again, as a reminder, we're in Region 8 with Kane County. And you will see that we are very close to that 20% cutoff. We're at 22%. And if you go back and look at the past several months, you'll see that as recent as July, we had closer to 50%. No, July of last year, I apologize, July of last year. We had 50% capacity. And now even with the amount of vaccine, because we have done a phenomenal job in DuPage in getting vaccine out, even with that, we still are at the lows that we saw. Again, it's just another way of reflecting what the prior graph showed about capacity being limited about the same way it was in our March, April. So what this tells us is, and again, to issue a disclaimer, no one knows what happens next, and certainly that's not me. But however, we do see that we haven't peaked yet. We anticipate that this wave, like others, will have that peak and then we'll start falling again. But we are at a point now where we're 1, 2, or 3 weeks into the new school year. We're seeing cases in our schools that are resulting in kids needing to be isolated or quarantined. We're seeing, the mask mandate that was issued by the governor so that we don't have further impact on businesses. And so I think we're at a transition point where we have the ability with our behaviors now, and as well as expanded, continuing to expand vaccine availability to people who not only live in DuPage, but visit DuPage, who are fully vaccinated, to begin having a positive impact on lessening the curve. But we're not there now. Our cases are going up, our hospitalizations are going up. The one piece of very good news is, hats off to our healthcare provider partners who have gotten so highly skilled in saving people's lives. And even if they are on death's door, literally, the ability to to get those people onto a path of recovery is pretty astounding. So we're also seeing that most of the people, this is my final point, most of the people who are hospitalized and our, as well as our cases, the vast majority are in unvaccinated individuals across our community. Chris, anything to add?
Just the vaccine rates, I think on Karen's last point there, we're, have made tremendous progress in getting people vaccinated here in DuPage County. We have one of the highest rates in the entire state. That still leaves several 100,000 people that don't enjoy the protection of those vaccines. Primarily our children 0 to 12 who are not eligible, but an additional number of adults in DuPage, some who have chosen not to be vaccinated and others that don't enjoy the full protection vaccines provide because of underlying health conditions. So despite our great rates, we want to keep pushing those as high as we can. I do think it's important to recognize that there are many individuals in our community that cannot be vaccinated, including children.
Thank you so much, Karen and Chris. It's a disturbing but very necessary update. And to just reiterate, so I'll be the third person in a row saying it, get vaccinated. Again, you have to do it not for yourself, not just for yourself, but for those who are unable to receive the vaccine. My youngest is too little to have the vaccine. We have to protect our kids. We have to protect our vulnerable communities. And the data is showing these vaccines work. Get vaccinated. I would like to ask if any members here of the committee have any questions for Karen or Chris that they can answer. Okay, seeing none. Karen and Chris, can I ask you you spoke about it last week, and I think I'm paraphrasing, but you were saying the number one goal that we have is to reduce the amount of community transmission, and that means staying out of large gatherings. So do you have guidance about whether it is safe for us to conduct this Fine Arts Festival at the end of September? We are expecting a very large crowd. This is a very multi-day event, and we want to make sure that we are putting public health and safety at the forefront. Can you speak to that, please?
So again, not knowing exactly what's going to happen, not having, certainly, Member LaPlante, you have provided some information about what would be occurring, but we don't have detailed information, nor would that necessarily inform our decisions in any way. What we know is that until we get the level of transmission in our community back down to low, which it just was, we can do this. Until we get it down to low, we're risking sacrificing all of the progress that we have made, because the more the virus spreads, every time it spreads, it's an opportunity to create another slight variant that's a little bit more virulent and may not be as responsive to the current vaccine. So we're asking people to when you're out in public, particularly indoors, to wear face coverings, to make sure and be vaccinated. If there's any chance of avoiding large gatherings, please do so. Particularly, we see that the spread of virus just by virtue of the activity, whether it be playing an instrument, an instrument, not the viola or violin, but something that has airborne qualities, or singing loudly, tends to extend the virus and spread even further. So those are the the reminders, the kind of safety guidance that we're really encouraging people to adhere to. And again, Chris, please jump in.
Yeah, everything Karen said, and the only thing I would add is that, we look to our prevention measures to scale along with those community transmission levels. So when we're at blue, the prevention measures we take look very different than when we're at a period of high transmission across the community. When we're at that very high end or the high end of activity, we want more activities to reflect the prevention measures that we know reduce transmission. So there, we're asking people to cut back on some of these non-essential activities so that we can keep kids in school, so that we can keep businesses open that provide essential functions. We really need to prioritize those, and where we have discretion and opportunities to modify our behavior, we should take those, because we can and have been down in that blue transmission, like Karen said. And at that point, even in yellow or low, we're in a much different position than we're in when we're in high transmission.
Thank you very much. That's very clearly stated and very well put. And I know that we do have some of our community partners here who have been seeing, they've been having to make these really tough decisions throughout in terms of the arts and large gatherings. I know some of us have had to make those decisions very personally, and it is tough. Upon the action of this committee, based on the news that we are receiving today, I move that we postpone the DuPage Fine Arts Festival until the spring of 2020 in the best interests of public health. Sorry, did I say 2020? I'm thinking of the good old days, the before times, before any of this happened. I thought I could make it just take us there. 2022, in the best interests of the public health and to reduce the likelihood of further harmful spread of the COVID-19 virus, the Delta variant, and also, as Karen pointed out, new variants. I would like to, so I put into motion, thank you so much, Ashley. And Angela, will you please do a roll call? Oh, we don't have to do a roll call. Okay, voice vote. All in favor?
Aye.
Any against? Okay, there are no one's against it. The ayes have it. Thank you very much, everyone. Upon the action of this committee, I will ask Chairman Cronin to reallocate the $100,000 approved by the county board for this festival to his fiscal year 2022 budget. And I just want to make a statement here that I really appreciate everyone stepping up and being leaders. This is what leadership looks like. It's having to make hard decisions. We have all worked so very, very, very hard on this initiative. I've been working 7 days a week around the clock. Jim McGuire from the Fair Association and all of our other community partners, we have really partnered up and done a great job, and we're excited about this event. But we've always said, when you are a community leader, when you're an elected official, your first and number one priority is always to protect the people in your community. And that's what we're doing. I would also call on other community leaders, other elected officials to take these words to heart, to take the words that are in the advice of our health department and make similar responsible decisions. This is our job. Our job is here to protect the people of DuPage County. I will also be working, of course, closely with Choose DuPage and the donors, our wonderful donors, our wonderful sponsors who've already stepped up, and we're going to ensure their continued support of this event. We're excited to pick the new date in the springtime. We're all going to be thinking extremely positive thoughts that we're going to be in a much better place. Of course, there is no crystal ball, but we have to act and plan that we will be successful in beating this virus and getting the community transmission down. And this is how we live our lives. We make plans, but we follow the changing science and the changing data to the best of our ability. While I am disappointed that we cannot conduct the festival in September as we hoped, I know we made the right decision here today. I anticipate we will hold one more meeting to wrap up any loose ends from this year's business, and we will meet again closer to the beginning of the year and the new fiscal year as our planning gets underway once again. Thank you, everyone, for your thoughtful approach to this event and for today's decision. And I would really like to say a very special thank you to our health department led by Karen Ayala and Chris Hoff. We appreciate you so much. We see the hard work you're doing, and we are here to support all of your work and all of your guidelines. Thank you so much, everyone. So let's move on. Is there any old business that anyone has? Okay, seeing none. Any new business? Seeing none, then I make a motion to adjourn this meeting. Okay, we can have a voice roll call. All in favor? Any against? This meeting is adjourned. Thank you, everyone. Thank you to all of our friends who showed up on Zoom. Have a good day, everyone. Be safe and get vaccinated.